the armed forces, was the architect of my life, teaches you to abandon to be a poor leader. You have to be a good leader. No dilution to accountability, and absolutely no compromise in ethics under pressure. I did not abandon any of these traits which was taught to me. In the corporate world, you cannot be only commanding and controlling. It is about alignment, it is about collaboration, it is about influence. So while my language has softened, my standards have not.
In today's conversation, we have with us Captain Dr. Usha Banerjee, who is the Group Director of Nursing at Apollo Hospitals Private Limited.
The ethos and fabric of nursing revolves around compassion, kindness, empathy. One of the biggest problems in our country for nursing is not the shortage. It is the silence. Nurses have been managed rather than being empowered. Nurses are the largest healthcare workforce. Inclusion of nursing in strategic affairs, policy making, is so imperative today for the success of healthcare in the country. And just marginalizing them and not involving them is not just an institutional risk, it will be a national risk. And it's important to strategically invest in building quality of education, to invest in the empowerment, positioning, visibility of nursing, pay, perks, remuneration, the welfare. We need to run our healthcare on very empowered, knowledgeable nurses. You cannot run it on marginalized, exhausted, underprivileged nurses.
When do you look back on your journey, what legacy do you hope your leadership leaves behind the Indian nursing?
The biggest legacy that I'm going to leave behind is not just my professional abilities, but a little bit of me, I'm sure, will live in a lot of people's hearts and their souls, because I've been a good human being, a good leader, and especially because I lead women and very young women. So while I taught them, I also learned a lot. Fortunately, today's generation learns very fast. They're ambitious, they're aspirational, they're enterprising, and they're willing to learn, and they're willing to shed barriers.
The most misunderstood aspect of nursing leadership?
That nurses are too silent to be included in policy making.
That's quite powerful, ma'am.
Every nurse has to be clinically competent. They need to be socially sensitive. They need to be ethically engaged. They should strive for safety. They should have a quest for quality, and they should work without fear and favor. And for every single leader, I think it is important to have that persuasive passion and an obsessive optimism and unrelentless drive that the best is yet to happen for nursing.
Hello and welcome to the Compassionate Voices, brought to you by Voice of Healthcare in collaboration with Polymed Private Limited. This series honors India's nursing leaders, who are the backbone of our healthcare system, whose compassion, courage, and leadership has quietly shaped patient outcomes, healthcare quality, and the future of nursing in India. In today's conversation, we have with us Captain Dr. Usha Banerjee, who is the Group Director of Nursing at Apollo Hospitals Private Limited. She is an Armed Forces Medical College Gold Medalist, President's Awardee, and a decorated Army nursing leader. Captain Dr. Banerjee spans military nursing excellence, enterprise healthcare leadership, policy reforms, accreditation, and national advocacy for nursing. So with the advanced qualification around nursing, hospital administration, and management, she has been at the helm of nursing leadership across some of India's most respected healthcare institutions. A member of Indian Nursing Council nominated by Ministry of Health and Family Welfare, key contributor for NABH accreditation and industry task force, a prominent national voice for nursing across media platforms. Her work reflects not just leadership but legacy building. Welcome, ma'am, to our show.
Namaste. Thank you. Thank you, Ms. Simran.
Thank you so much, ma'am. It's an honor to have you with us here.
I'm grateful that you have me here.
Thank you so much, ma'am. Ma'am, we have heard a lot about your journey and we are all inspired. And when you begin your journey, you started, the benchmark you set in the starting was quite high, like gold medalist, best all-round cadet at FMC. That achievements are quite high in the early start only. So if I have to start and understand what first drew you towards nursing and when did you realize that leadership will be the central in your journey?
Well, I, with great pride, say that I didn't choose nursing. Nursing chose me. I was destined to succeed. I've said this in earlier podcasts that I actually started as an engineer. I abandoned engineering and then got into nursing. Those days, I wanted to be a doctor, but I just didn't get into medical school. And my next option was to get into the military.
Yeah.
And nursing was one way to get into the armed forces because I belong to a family full of military people. So my destiny was to succeed, and nursing was my conduit for that. And at a very early age, I knew that nursing brings in intellect, intuition, and integrity as a discipline. And it is a profession where science meets humanity.
Yes.
And sometimes your decisions will have irreplaceable consequences. And it is not just intentions, it is collective action that saves human life. And I thoroughly have enjoyed my stint of being in nursing and as a nurse leader. And at a very early age, I realized that leadership is not an aspiration, it's an awareness. As you mentioned, I started brilliant in my early career days. And I knew that individual brilliance alone is of no use in a system that is very fragile.
Yeah.
If you really want to bring in credibility to that success as a great student, I think it's important to change systems. And I was very fortunate to enter into the armed forces, which is the architect of my life.
Yes.
My teachers gave me unshakable academic foundation, unmatched clinical acumen, and a turf to explore my talent, and of course, to be a great leader at a very, very young stage. So today, here I am with the wisdom to lead, the humility to celebrate my success, the aspiration to aspire for more, and so much more that I have to give to the country and to my profession.
That's amazing, ma'am. It's great to hear your journey, how you began. And like you said, you didn't choose nursing, nursing chose you. And I think the way was already made by God and you just followed the path, I believe.
Oh, I think it is the divine interpretation of the universe. And I'm so happy it all happened.
Definitely, ma'am. Ma'am, you, like you said, you have military roots. And your years in armed forces shaped not just clinical excellence, but discipline, resilience, and courage, and also ethical leadership there. Then followed by a rate transition into a large-scale corporate healthcare leadership. So what do you think was the most defining leadership lessons from the Indian Army, and how did you adapt those while, were leading the nursing across multiple complex hospital enterprises?
Well, I just mentioned to you that the armed forces was the architect of my life. And as every citizen of the country knows, it teaches you discipline, devotion, duty. What I say is it teaches you leadership. And it just doesn't teach you leadership. It actually teaches you to abandon to be a poor leader.
Yeah.
You have to be a good leader. Yes. Leadership in the army is unforgiving. There is no ambiguity to responsibility, no dilution to accountability, and absolutely no compromise in ethics under pressure. So that's what is ingrained into every citizen who enters into leadership. And as I was a good student, I was always given leadership responsibilities, and these traits have been built into your DNA.
Yeah.
And I did mention to you that I come from a family full of army people. So even as a young child, we've seen this, and it's part of the fabric of my existence.
Right.
So when I got an opportunity to enter into the corporate world, fortunately I entered into the best brands, Manipal Hospital, Max Healthcare, and now at Apollo for more than 2 decades. I did not abandon any of these traits which was taught to me by me by my teachers. I only adapted to the new way of governance and leadership because I knew that in the corporate world, you cannot be only commanding and controlling.
Yes.
It is about alignment, it is about collaboration, it is about influence. So while my language has softened, my standards have not.
Yeah.
The traits that I carried from the army became the most valuable traits for my leadership. So I bring in discipline, duty, devotion. I bring in an idealized influence and intellectual stimulation and an inspirational motivation as my leadership trait for my people. And I think that is what has seen me this far. Yeah.
Very well said, ma'am. Like you just said, the leadership qualities which has been taught into the Indian Armed Forces or inculcated in you, that doesn't get dissolved. That gets evolved over the time and according to the situation which comes up.
Yes, yes.
Ma'am, you must have faced different difficult situations while you transitioned into the hospitals and health, some of the organizations like Manipal, Apollo, Max. So, as a group director of nursing at Apollo Hospitals, you have influenced thousands of nurses across diverse geographies and specialities. So, how do you ensure that consistency, nursing quality, culture and compassion at such an enormous scale maintains through?
Well, I think to lead one organization, you need competence.
Yeah.
And to lead a plethora of institutions and a large number of people, you need architecture.
Correct.
And I know charisma is irrelevant and intentions are insufficient. What will drive you to success is to build an ecosystem where every single day standards are reinforced, mistakes are corrected immediately, and then you set governance in order to enable people to function to their highest potential. So honestly, if I say, I don't think it was very, very difficult because the ethos and fabric of nursing revolves around compassion, kindness, empathy. And I think every nurse that you lead brings that to the table.
Yes.
It is just that you need to be a force multiplier, that people can come to work, they can do their best, and the systems enable the best for them to be productive. How we have reached there is, I for one, now that I'm in Apollo for last 20 years, I believe in one Apollo. So whether you are in a metro city or you are at the periphery, the nurse, the patient, and the outcome requires identical rigor. And our standards are same everywhere. And you have such talented people who are leaders along with you. You unleash their potential. You get the best out of the teams that you command.
Yeah.
And I think together you can just scale up meteorically. And that's what I do. And nothing is impossible.
Very rightly said, ma'am. If I believe leader has that quality, who understands each and every individual and then strengthens their quality so that, the entire team becomes strong.
Yes.
And you are doing that so greatly since, I believe the start of your journey, like you said, and we also know about it. The Armed Forces career you were leading, you were quite, the gold medalist since the start of your career, and you were given all those leadership qualities, roles out there. So I think the vision was there since beginning.
Oh, I've just been blessed and I'm very, very fortunate. I still have countless blessings of my teachers and I thank them every single day for my success. I've had such a great rise in my career. It's been meteoric. I've been able to function at a time when the healthcare in the country is transforming, and I've been a part of it. And it's been a fantastic journey. And I wish the country produces many, many leaders. And I'm very proud of all my colleagues, my friends, people from my alma mater who are all at leadership positions today and who are making a big difference to put our country on the world's map. And very happy with the progress so far.
And we are also, really happy and privileged to see your leadership, to witness the changes you are making into.
I must say industry partners have played a big role too.
Yeah.
So I'm grateful to them equally.
Thank you, ma'am. Ma'am, you are also actively involved in the national task forces, accreditation bodies, and the Indian Nursing Council, playing a key role in shaping the nursing standards and reforms. So, what do you think? Why is it critical for nurses to have a voice in policy, regulation, and accreditation? And how can nurses, leaders ensure that these systems truly empower nurses while strengthening patient safety?
Well, I think one of the biggest problems in our country for nursing is not the shortage. It is the silence.
Yes.
Very often, nurses have been described rather than being defined. Nurses have been managed rather than being empowered. And sometimes they have been acknowledged, though they have not been structurally involved. And I think this imbalance must change.
Yeah.
Nurses are the largest healthcare workforce. Inclusion of nursing in strategic affairs, policy making, is so imperative today for the success of healthcare in the country. And just marginalizing them and not involving them is not just an institutional risk.
Yeah.
It will be a national risk. Healthcare that drives great outcomes, institutions that include nursing in being a strategic partner have all seen success today.
Yeah.
And I'm an example.
Yes.
I've been strategically positioned at the group level as a group head. And we've done such credible work in patient safety, clinical outcomes, quality, reputation of the organization. And I think every organization stood witness to the kind of work nurses did during the COVID crisis.
Yes.
Right?
Yes.
And WHO celebrated 2020 as the year of the nurse.
Nurse.
So I think it is important both for nursing to feel empowered and be visible and shape policy, for organizations and enterprises to include nursing as a strategic asset rather than a variable cost, and for industry partners, for media, for patients who receive healthcare to give voice to this profession. Then I think the next 10 years will be a different setup for healthcare, because we understand the challenges of healthcare today.
Yes.
And with emerging diseases, with the challenges that our citizens face, we need good nurses to govern healthcare into the future.
Very rightly pointed out that nursing must be empowered. They must feel empowered because, like I said in the starting, they are the backbone of our healthcare system.
I changed that. I no more say they are the backbone. I say they are the heartbeat.
Heartbeat.
And when the heartbeat stops, it's a straight line.
Yes.
And we're finished. So I've transitioned into calling them as the heartbeat of healthcare.
Very rightly pointed out. They're the heartbeat of our health system. Yes. And I believe without nursing, even that is a very important and strong pillar of our healthcare.
Yes.
With all due respect to the doctors who do surgeries, treat patients, but ultimately the entire care is given by our nurses.
Yes. Yes.
And we all respect and acknowledge the work done by nursing in our Indian healthcare system.
But I still feel nursing deserves much more recognition for the kind of work they do, for the clinical outcomes they generate, for being the pillar of accreditations, for driving patient safety, for driving even the clinical practice of clinicians, and of course for reputation and reimbursement of the organization. Yeah, they're very critical.
And ma'am, for that, you are one of the strong voices into nursing.
Yes, I've been a strong advocate.
Yes. So, a visible, respected voice for nursing across national media platforms. We have also seen you on national television with Mr. Amitabh Bachchan, being spoken vocal about the scenario of nursing during the COVID and how, the nursing helped patients and the healthcare industry to come out of it. Like you said,
Yes.
WHO also recognized 2020 as the year of nursing.
Yes. Yes.
So, to navigate that systematic challenges such as workforce shortage, burnout, and recognition gap, how important is public advocacy in changing the narrative around nursing, and what uncomfortable truths must healthcare leaders confront if nursing is to truly thrive in India?
I think I've touched a little bit of this in my previous question that you asked me. I think you need a larger lobby today to advocate for nursing. And it's important for nursing to become a profession of choice.
Yeah.
Indian nurses are the most respected in many, many countries worldwide. They're very enterprising. And with the kind of expansion that we have, this is a profession that deserves a little more investment, attention. It deserves attention from enterprises, but I think today, much more than that, media can amplify the voice of nursing, and you're doing it already. Industry partners play a big role, and they've come a long way.
Yes.
Citizens who are recipients of care must understand that nurses bring to value, and they drive care. Doctors drive cure. And we all work in collaboration to generate the outcomes that we are so proud today that our country is doing. And it's important to strategically invest in building quality of education, to invest in the empowerment, positioning, visibility of nursing, pay, perks, remuneration, the welfare. We need to run our healthcare on very empowered, knowledgeable nurses.
Yeah.
You cannot run it on marginalized, exhausted, underprivileged nurses.
Yes. Ma'am, following on that, when we have seen your entire journey, how vocal you have been about the nursing leaders in a media platform and the impact you have made. You have also been featured in Dr. Pratap C. Reddy biography, Healer. So when do you look back on your journey, what legacy do you hope your leadership leaves behind the Indian nursing?
Well, talking about Padma Vibhushan, Dr. Pratap C. Reddy, I say he's the greatest man who's walked this earth.
Yeah.
He is a divine interpretation of the gods themselves, handpicked and handcrafted to touch humanity. And to be featured in his biography, I don't think it's something that I deserved. I think it's more of his humility and the man that he is, that he featured many of us into his biography. And I feel that is one of the biggest gift I have for my lifetime. And not only just being featured in the biography, but the leadership at Apollo, chairman and his family, have given me a great place to work, a turf where I've been able to inspire and influence many, many lives. So I carry our chairman's vision, and I'm so grateful that he's made me part of that big journey. And that's changed a lot in the country. And I've been a small part of it.
Yeah.
So for me, I feel, and I've said this before, that at a very early age, I knew individual brilliance is not enough. You need to leave a legacy. And my journey has always been to be that strong advocate. And I think some things that I've done will live beyond me. A legacy where people will know that I've been able to transform nursing in the country, make them a strong voice, include them in policy, bring in more leadership roles, and of course, bring a lot of laurels to the profession. And the biggest legacy that I'm going to leave behind is not just my professional abilities, but a little bit of me, I'm sure, will live in a lot of people's hearts and their souls, because I've been a good human being, a good leader, and especially because I lead women and very young women. So while I taught them, I also learned a lot. So it's been a win-win for both of us. And that's been one of my biggest dreams, that I should be remembered much after I'm gone. And I think I've been able to craft my way into that space. So I'm grateful for the great institutions that I've worked in, the wonderful teachers that I have been trained by. My family, of course, a lot of military people. And my own ethos of wanting to do much beyond me as a person, much beyond my profession. But how is it that I can leave something behind for my country too? Otherwise, as a young nurse, I would have left this country and been in some foreign land doing well. But I've done much, much better, both for myself, for my profession, and for the country, and for the enterprises that I've worked, and for the people I've led. So that's my legacy.
You have made a deep and great impact into the nursing vertical of our healthcare system. And not only, I believe, into the industry, but amongst those young nurses you have led professionally, and also in terms of, I believe, in their human touch, or let's say the personal life. Because being a very young person, and I've been also blessed with great leaders and having such interaction, occasion to interact with you, all those things I believe teaches a lot to the young people out there who coming out, and the leadership lessons they learned while their leader is leading them, the impact they make into their career and life, it makes a great impact out there. So I believe not just by the work you have done, by how you have led each and every nurse individually, that has also made a great impact into their lives.
I think, even talking to you today is some lesson I'm going to take away. I'm sure every time you meet someone, you leave something behind and you take something along. And I'm very, very fortunate that I lead a workforce which gets influenced because it's their early stages of their career.
Yes.
They look up to a leader. And especially being a woman, they also look not only of how they can professionally grow, but how is it that a person can balance their work life, personal life? How do they bring that charisma into their leadership? And I think, fortunately, today's generation learns very fast. They're ambitious, they're aspirational, they're enterprising, and they're willing to learn, and they're willing to shed barriers. And for me, since I'm a feminist and I like empowering women, I teach that very subtly, may not be very loudly, but it comes into my interactions with people. And I'm glad many of them have transformed their lives by just meeting you and being with you. And that's what I wish to do.
Thank you so much for all those impact and great wisdom words you have spread in this podcast and also in the lives you have led. Ma'am, with this, we'll move forward to our rapid fire round.
Okay.
So there are a few questions and I would expect some fiery rapid answers on that.
Okay, let me try.
Starting with one word that defines your leadership philosophy.
Ethics and integrity.
That's quite important. One non-negotiable leadership habit.
I think it's important to influence and trust. Non-negotiable.
That's right. So the most misunderstood aspect of nursing leadership.
That nurses are too silent to be included in policy making.
That's quite powerful, ma'am. one change you wish to see immediately in India's nursing ecosystem?
Nurses to be positioned at the helm of affairs in policy making across the country.
Yeah. It needs to be. A healthcare innovation that excites you the most?
It's all about ABC, artificial intelligence, big data, cloud computing. All that should be leveraged by nursing to transform care at the bedside. And I always say I wish every nurse has a mini Alexa in their pockets so that they can command a lot of technology to enable care.
Yes. So if not a nurse, what would you have chosen to be?
I still would want to be a military person, maybe in a different role other than just do nursing, probably fly aircrafts, get into war zones, etc. If not, maybe a dancer.
That's great, man. So in 3 words, the future of nursing in India looks like to you?
I think nursing is going to go meteoric, very powerful, very included, and at the command stations, probably.
Ma'am, that was our rapid fire round. But before we let you go, I would like to have a final message from you to the young nurses who are just starting their career or who have just started right now. Any message you would like to give to them?
I just feel every young nurse who enters the profession should understand that this profession can give them so much.
Yes.
It has given me when I started way back, and today is a new world. Every nurse has to be clinically competent. They need to be socially sensitive. They need to be ethically engaged. They should strive for safety. They should have a quest for quality. And they should work without fear and favor. And for every single leader, I think it is important to have that persuasive passion and an obsessive optimism, an unrelentless drive that the best is yet to happen for nursing.
That was quite strong and hopeful for the nursing industry in our India. Ma'am, thank you so much for the conversation we just had. It was amazing. It was full of insights, the experiences you have, the wisdom you gained in your journey. So that was a lesson for us to, and to all our audience who are listening to this. Thank you so much for sharing your, experiences and insights with us.
Thank you so much. I think I'm very, very grateful that every time you get to be featured, I think it's gratitude, immense gratitude that somebody is taking their time out and doing this. And I hope many, many people aspire to become nurses.
Yes.
And many nurses who have entered the profession make it big. It's a great profession. You know that I have many other qualifications.
Yes.
And I never branched out.
Yes.
I've always stayed in nursing. And it has given me so much more than I expected or I wanted.
That was the continuous vision and the path to follow, I believe. And you have done that so beautifully and elegantly in your journey.
So much more to do.
Definitely.
Thank you.
Yes. Thank you so much, ma'am.
Thank you. Thank you.